in the humerus, which is going to articulate with the trochlear notch of the ulna. So then we moved into the ulna. What portions of the ulna are important? So the trochlear notch is the concave surface of the crescent moons. What's the beak's name? The what?
Meaning to do that to me?
The encomial process.
I need to
Okay, and then on the distal end of the trochlear, so if we had a ulna, right, so obviously this is a horse because it's a fused ulna and radius, right, mid-shaft. So with the ulna, if we were just looking at it from the concept of a dog and cat, right, we had the trochlear notch, we had the encomial process, we had the medial and lateral coronoid processes, which are the facets on the medial and lateral aspect that's articulating with the radius. What's this? Olecranon process, right? That's the point of the elbow. Okay, and we work our way down the shaft of the ulna to get to the styloid process. Okay, so it just comes to a point on the ulna, right? This one, you're not really seeing it as well because it's the radius and the ulna fuse. So if you look back on your friend here, right, styloid process of the ulna, and then if you look on the radius, the point on the radial side is going to be a styloid process over there as well. So with the radius, what structures on the radius are important? The head of the radius, and again, this head is odd because it's not like other heads, which are usually rounded. The head of the radius is more of a flat articulating surface, and then we had the shaft, and then we came down to the styloid process on the medial aspect only. Okay, and then we got into the carpus. So how did we deal with the carpus? So 2 rows. So proximal row is named radial in a dog, radial, ulnar, proximal row, accessory, right? So there's only a radial under the radius, an ulnar under the ulna, and then an accessory coming off the caudal lateral aspect. In the horse, right, it was radial, intermediate, ulnar, accessory. Okay, and then the distal row?
We numbered them.
1 through 4, medial to lateral. Okay, metacarpals?
Numbered from 1 to...
Numbered 1 through 5.
From
medial to lateral.
With the dewclaw being number 5?
1.
So dewclaw's number 1, right? And that's over on the medial aspect. Okay, so then we went into our digits. 1 through 5 on the front, right? 1 through 5, medial to lateral. Phalanx, right? So the phalanges, how many phalanges are in each digit? Except digit 1. So digit 1 is only made up of 2, proximal and distal. Digits 2 through 5 are made up of proximal, middle, and distal. Okay. And then the nail, that's the ungual process. In a cat, right, that's connected. In the cat, the nail and P3 are 1. In the dog, the nail is separate. Okay. So proximal, middle, distal, or P1, P2, P3. Okay. So if you were to name this or label this, you would say that is the proximal phalange of digit 2. Does that make sense? Okay. So then we had our pelvic limb. So what did we need to know about our pelvic limb?
The pelvis.
Ilium, the ischium.
So pubis. So pelvis is made up of ilium, ischium, and pubis. So this is the ilium. This is the ischium, and this is the pubis. What else do we need to know about the pelvis?
The hole in the middle is lighter. The hole in the middle, so it's lighter.
So what are the holes called?
Foramen?
True. What kind of foramen? Obturator foramen? You're all like, obturator foramen are the two holes in the pelvis. Okay, what about the junctions of the pelvis, right? So we had ilium, ischium, and pubis on both sides. So it's actually 6 bones fused. So where are they fused? So in the middle of the pubis, that's known as the pubic symphysis. Okay, and where else are they fused?
Between the ilium and
Between the ilium, ischium, and pubis. They all three fuse at the acetabulum, right? That's the socket portion of the hip joint, right? The acetabulum. All right. This structure is known as the wing of the ilium, right? In other species besides the dog and the cat, if we looked at the cow or the horse pelvis, right? We had these really dramatic processes off of the wings. So what were these processes called? Tubersacrally. Does it ring a bell to anybody?
No.
It's in the PowerPoint. Tubercocci. So ring a bell to somebody. So tubersacrally, tubercocci. And then on the back of the on the ischium, those are your ischial tuberosities, right? That's where the little swirls are, the butt bones, the pin bones, right? So that's your ischial tuberosities. All right, so then we go into the actual bones. So this is the femur,
Patella.
patella. The fibellae are not here, but they would have been back here on the caudal aspect. Big bone, tibia,
Tibia.
little bone, fibula, tarsus, metatarsus, digits. All right, so what do we need to know about the femur?
The head.
The head, which is the ball portion of the head and of the ball and socket joint for the hip. So greater and lesser trochanters, which is the point of the hip. Then shaft. So condyles are on the caudal aspect. Epicondyles are going to be on the medial and lateral sides of the condyle. What about the big groove where the patella is riding in? Trochlear groove. Okay, then we had our patella. Nothing really special about him. Fibellae, nothing really special about them. So then with the tibia, what's important to know about the tibia? So what'd you say? Condyles. Okay, so remember condyles, that's like the only bone that has condyles on the proximal end. For everybody else that we've talked about, it's always been the condyles were the distal end. The tibia is annoying because it has to have condyles on the proximal end. What about the big triangular portion on the cranial aspect? Tibial tuberosity. And then again, it comes down to, the cranial 1/3 of the shaft. That's the tibial crest. Okay, come all the way down on the medial aspect. That is the medial malleolus. All right, fibula. What's important? Okay, so on the distal end we have the lateral malleolus, and then the head. That's really the only thing's important for that. Okay? Then we come down into the tarsus. What do we know about them? So it's got that kind of it's 2 rows, but there is that overlap row, right? So what were the bones? Big guy? Calcaneus or fibular tarsal bone. The weird, like, horny looking structure. Talus or tibial tarsal bone, right? It's the one under the tibia, it's the one under the fibula. What important aspects of those bones do we need to know? Point of the calcaneus. Nope, the accessory was in the front, so this is the calcaneus, but the point of where all the tendons are attaching, that's the calcaneal tuberosity. Alright. Then underneath those two bones, we went and had the central tarsal bone, and then beneath that, we had the distal row, which was 1 through 4, medial to lateral, right? So remember, it was kind of drawn like this. Right, so we talked about it being 2 rows, but technically it's like 2 to 3, depending on which side you're looking at. Right, talus, calcaneus, central, 1, 2, 3, 4 overlaps. Okay? Medial to lateral. Okay, then we got into the metatarsus.
1 through 5.
2 to 5.
2 through 5, right? 1 is missing, right? So 2 through 5. And then in the digits, so digits 2 through 5, and then proximal, middle, distal, right? No dew claws in the back, normally. Okay, we good on appendicular? Okay, so for axial, we'll do skull in a second. We had the spinal column, which was
7
cervical, always 7 across the boards. Okay, what do we need to know important about cervical?
Atlas.
So atlas and axis, C1, C2. What's important about C1?
It doesn't have the CS bone.
Where the skull meets.
Yes,
Oh,
yes,
that-
sort of maybe yes. I heard like 2 or 3 right things, and I heard one thing that was a little sounding. So,
The widest wings.
importance about them is we had the wings of the atlas, right? What are the unique characteristics that I could pin? That's what I'm asking.
They're very,
The what?
they're very wide.
Very wide. the wings, you mean?
Yeah.
Like, okay, the transverse.
Transverse or
What about the spinous process?
It doesn't have one.
It doesn't have one. Okay. Right, it has no body. Right, that was the unique trait about the atlas. Okay. What about the axis, C2?
It has a bone.
It has
and
a-
spinous process.
It has everything else like the rest, but the spinous process is a blade, right, that juts over, and then it also has the dens, right, which is the little nubbin that's articulating with C1. So make sure you can look at it on the horse because we can pull those off. We also have a bunch of bones
Doing this little thing.
up in here. Yeah, so you can look at it here. Whoa.
they're trying to
Like a chain.
Ah, well, they connected them so that you can kind of see them all, right? So C1. This is not corrected.
the other
This
way.
is not connected appropriately, so this is backwards. So this is the dens. Alright. So C1 through C7, 1, 2, 3, 4, 5, 6, 7. So if I labeled one, right, you'd have to tell me it's cervical vertebrae and then the number. Okay? And then we went to
Thoracic.
thoracic. So in the dog and cat, 13,
13.
right? And how do we tell what's thoracic? Oh,
The ribs.
ribs, right? So there should be lateral articular facet joints articulating with ribs. Okay, so you know they do have obviously the same characteristics: the dorsal spinous process, the lateral transverse processes, the body. But don't forget, you know, they can change shape, right? So you can kind of see around 10, 11, we got that anticlimactic. Where all of the spinous process were originally going this way, and then all of a sudden they start going this way. So they kind of take on the appearance of more of the lumbar vertebrae, but you can see the lumbar vertebrae have very extensive lateral processes, whereas the thoracic do not because they have the articulating joint facet for the ribs. Right, so for the dog and cat we had 13 thoracic, and then we had 7 lumbar, and then sacral.
Between 5 and 20.
Sacral.
Are they fused?
Four.
So it's the sacrum, it's fused, and in the dog and cat it's 3. In certain cow, in the horse, it's 5, I want to say, 5 or 6. Thanks. So dog and cat 3. So I might, say what is this, and I could have a supplemental question saying how many bones are fused. Okay, just so you know. And then coccygeal, caudal,
Between 5 and 20.
between 0 actually, and however many, right? Because some animals are going to have them completely gone, right? A Manx cat has none. Okay, a bulldog might have 2 really ridiculously weird ones. Dobermans usually have 2 or 3. So it just really depends on the breed. So I could say how many coccygeal vertebrae does this dog have? And then you'd have to count them out. Okay. And you can see coccygeal vertebrae can change shape as well. Okay, so as they get to the tip, they look more like phalanges, right? But where they're higher up at the base of the tail, where it's connecting from the sacrum, they take on more of like the lumbar vertebrae appearance. Okay. Ribs. What do we need to know about ribs? So sternal, asternal, and floating. Sternal are true ribs. What does that mean?
Attached to the sternum.
Their cartilage is directly attached to the sternum. Asternal.
The cartilage.
Their cartilage is attached to the preceding ribs cartilage. And floating,
Not attached.
their cartilage is not attached. Okay, this junction is known as this is the intercostal space, but the junction is the costochondral junction, and this is the costal cartilage. Right? Bony rib, costal cartilage, costochondral junction. Okay, sternum. What do we need to know about the sternum?
The xiphoid.
Manubrium.
Manubrium.
Okay, so they're made up of an individual sternebrae. What's the manubrium?
The top.
Sternebrae 1. Okay, so that's your point of your breastbone. And then
The xiphoid.
xiphoid, right? That's the last sternebrae. And then there is the xiphoid cartilage. Some of these guys have really extensive xiphoid cartilage. Okay, so make sure you note that. And then hyoid apparatus is not on here. Okay, good. So skull. Skull is a little more involved. It's gonna be a little tricky for me to point them out, but we'll go over them just as a group like we did last time. So how many total skull bones?
37 to 38.
37 to 38, depending on what?
The fusion of the mandible.
The fusion of the mandible from 1 or 2 bones. Okay? Alright, so for the dog, we're talking about how many total? 38. Good. Alright, so we divided it up into how many sections? 3 sections, right? So we did cranium, ear, and face. Did we ever find the ear bones? Boo. Alright, so cranium, ear, and face. So obviously you need to just remember the ear bones for the purposes of the number. I could show you a picture on that for the written exam, though, to ask you what those were. But so cranium, ear, and face. So we started with the cranium, and we started most caudal, and then worked our way up. And then when we did the face, we started most rostral and worked our way back. So for the cranium, we started with the occipital bone. What was important about the occipital bone? Magnum foramen. So that's where the brainstem, spinal cord is coming out of. Occipital condyles, that's where we're articulating with C1, so the atlas, okay?
And the temporal bulla.
So what did you just say? Temporal?
No.
So that's not the occipital then, right? That's going to be part of the temporal bone, the bulla, right? So for the occipital bone, it's just the occipital condyles and the magnum foramen. Okay? Then we went into paired bones, interparietal, parietal, temporal. So what's important about the temporal bones?
It goes a little bit inside by the joints and it comes out and meets up with the zygomatic.
Yep, so it's forming the caudal portion of the zygomatic arch, right? It's also forming the portion of the interior portion of the orbit. The hole for the ear, right? External acoustic meatus. And then
Temporal bulla.
the tympanic bulla in the temporal bone. And then TMJ joint. right? So temporal bone has a lot of processes, a lot of important aspects to know for that, to make sure you do know that, because I'll probably ask you a question on that. Okay, then so we had 1, 2, 3, 4, 5, 6, 7. So then we had our frontal bone. So what was important about the frontal bone?
It's in the front.
Frontal sinuses, right? Okay. And then we had 2 internal cranial bones, right? When we look through. So the ethmoid and the
Oh, no, the,
sphenoid. Okay. So sphenoid, ethmoid. All right. So that was 11. Yeah, 11. So then we moved into the ear bones. What were the ear bones?
Pinna.
Stapes, malleus, incus. Okay, and paired. So that's 6. And then we went into the face. Right. So starting most rashly, working our way back, we had the incisive bones. What was important about them?
the attachment to the incisors.
They house the incisor teeth, right? So there's 6 incisors. Okay, then we had the nasal bones, then we had the maxillary bones, and what was important about the maxillary bones? They hold the rest of the upper teeth, right? So your canines through your premolars through your molars. What else is important about the maxillary bone?
It has the foramen.
Which one?
Maxillary.
Orbital foramen.
Infraorbital. Infraorbital foramen.
Because it's in front of the orbit.
What else is important about the maxillary bone? It forms the rostral portion of the hard palate along with the palatine bones. Okay. What was important about the nasal bones?
What's the nasal?
Turbinates.
Words and nasal.
Determines the size of the muzzle.
Oh.
Right, so for our kitty cat skull bones, right, they're really short and like triangular almost in shape, right? Brachiocephalic dogs, same thing. They have that very like blunt face, whereas in your dogs, right, they're longer. In the horses, they're really long. Cow is long. No, not cow. Pig. Pig is really long. Sorry, not pig. Boar. I don't teach anatomy. So with the dogs, right, depending on the species, it could be drastically different. You have like cats, like brachiocephalic dogs, ranging all the way to Afghans, right? And we had all the different names, right? Dolichocephalic, brachiocephalic. Make sure you're comfortable with those names, because I might give you one and say, what kind of dog would this be? Okay? So incisive, nasal, maxillary. So then we said palatine. Okay. Then where?
We have both sides of it.
This side.
Zygomatic.
So zygomatic bone. Zygomatic bone. This structure makes up the
Arch.
zygomatic arch. Zygomatic arch is made up of rostrally, the zygomatic bone, caudally, the temporal bone. Okay? What was the little teeny bone in there? Lacrimal bone, right? Had the lacrimal duct. Okay. Who's next?
Pterygoid.
Pterygoid, the pterodactyl. Pterygoid, right? And the pterygoid came down in the center, right? The sphenoid starts here and runs down a little tiny strip centrally, and the pterygoid came out on the sides. Pterygoid also comes up. Remember all these little bones in here? That's all pterygoid. So I could pin the pterygoid on the point, right? I could pin the pterygoid here. I could pin the pterygoid in here. So make sure you know this area.
So it's on the side of the sphenoid.
It's on the sides of the sphenoid, yes. Okay. Nasal septum,
Turbinate.
nasal septum, vomer, and then the scroll bones, turbinates. How many turbinates are there? 4. Dorsal, ventral, left and right sides. 2, 4, 6, 8, 10, 12, 14, 15, 16, 17, 18, 19. Oh! What is this? Mandible. Okay, and what's important about the mandible? Okay, so it makes the TMJ joint with the temporal bone.
Fused or not fused.
Okay, so mandibular symphysis will combine left and right halves, hold all of the bottom teeth. What's the structure? What's the structure? Ramus and shaft. What kind of joint is the mandibular symphysis?
Hinge. Oh, no.
So
This one's a hinge.
you would move.
Oh, steep. Oh,
So remember, there's a type of a joint and there's a name of a joint. So what's the type of joints in the skull?
Sutures.
Sutures.
Type of joints. Fibrous. It's the name of the joint.
Suture.
Sutures. Make sure you know the differences between those. What's the type of joint?
Ball socket.
Synovial, specifically ball and socket. What's the name of the joint? Shoulder. You make this complicated. He's like this. Glenoid head. Listen, I put a test question on a suture once, and somebody gave me like the frontal temporalis suture, and I was like, what? Maybe, I guess. I just wanted suture. Okay. So make sure you know the difference. So this one would be cartilaginous. Is it fibrous? Fibrous is immovable, right? Is this immovable? No. So it's cartilaginous, right? We had fibrous, cartilaginous, and synovial, right? The synovial had a bunch of different ones, so like the ball and socket, the hinge, the pivots. Make sure you know those differences as well, right? What's the yes and no? What's the yes and no joints, right? Pivot or hinge, right? Yes or no? Atlantoaxial, axial or atlanto-occipital. Make sure you know those, because I could ask you joint questions on these. Okay, what are the joints within the wrist? Okay, what's the elbow joint? Make sure you know that for the test purposes. Okay. All right. Any other questions? All right. So then, good. Let's go through bones.